going to be a tough budget process. 7:45, Friday, May 21st. Dr. Hoa Nguyen of the Physicians Advisory Group. Good morning, Doc.
Hey, good morning, guys.
Did you guys still having meetings and stuff?
I hope so.
All right. So last night,
I,
what do you got to report this morning? You had one last night?
uh, yeah, we met last night. We did some I guess some message out to the public to um, kind of answer some question and concern on the vaccine
Mm-hmm.
because we need kind of get people to come out to get vaccinated. In the past week or so, we see an increase in the number of people who turn out for the vaccination, which is good. We really need to reach our path here to get to at least 75-80% of the people vaccinated. So we see the number increase after we implement the new quarantine rule. And so we just want to again address some concern on the vaccine and encourage people to come out to do that. So that's what we do last night. We also talked about the mask, the new CDC guideline.
Right. What was that discussion like?
Especially with the Navy and
the
Air Force,
yeah.
are kind of relaxed their guideline on base on the masking for the fully vaccinated people. The same thing. I think at this point, what we feel like is that we're gonna wait and see the next few weeks to see if anything come out of this new CDC guideline. But we still recommend that even you're fully vaccinated, if you're around your family or the people that you know for sure they're 100% vaccinated, then in a small gathering, you can go without your mask if you know those people. But in public, we still recommend that you still wear masks. Just because you don't know who's around you that's vaccinated or not vaccinated. So. So that's what our recommendation still. I know the governor still mandate that we still have masks in the public. So we still going to support that. If you exercise outdoor or you on outdoor with not too many people, you can go without masks.
Yeah, Doc, I went to the gym one time, or the box as we call it. I went to the box one time. I started the workout with my mask on. I didn't even last 2 minutes.
Yeah, it's pretty tough. It's hot. But I would say that if you're indoor gym, if you're outdoor gym, that's different.
Yeah.
But if you're outdoor gym, I would recommend that you still wear the mask when you work out.
Yeah.
It's still a enclosed setting.
It was open air. But I like to think of it, Doc, this is like the high altitude training, when they wear that mask. So if you guys run with your mask, it's like double the workout, right? Right? Yeah. You're a doctor.
That's part of the training, right? So I think that's a good way to look at it.
There you go.
But yeah, so I would say that in the small gathering of family member, if everyone vaccinated, then I would drop the mask. But if you're around other people that you don't know if they vaccinated or not, then I would continue to wear the mask for now. Again, it's to protect you and protect other people around you. And you have some positive case there in the community. I wish the number is lower, but unfortunately, it's still it's still high. So still encourage people to use the 3W. And again, to remind people that we have like 8 people in the hospital. They all 8 of them are unvaccinated so far. So please go out there and get yourself vaccinated. So that way we can cut the hospital admission down. And also remind people that even you're fully vaccinated, you can still catch the virus, but again, protect yourself. But if you're fully vaccinated, then hopefully you're not that sick. That's what we're seeing.
What was the discussion like, though, Doc? Because you said you guys discussed this no mask for fully vaccinated people on Anderson Air Force Base, Big Navy. But you also said that the PAG has decided you want to wait a few weeks to see what happens from that, right? So
Yeah,
what
you
were
know,
the
even
what were the doctors saying?
you
Were
know,
like, oh my god, it's crazy, or were they like agreeing with it, or
yeah, even in the nation, it's a lot of different thoughts and ideas. Some people support that, some people don't support that. And so again, to be conservatively and to be safe, I think that for the state is different. People in the state they are very reluctant to wear masks, and that's not the normal culture. But for us on the island, we are so used to wearing masks already, right? I mean. Uh, Even if you get out of your car, you walk somewhere, you have your mask, you run back and get your mask. You're so used to it. So I think that the discussion for wearing masks or not is for academic, So, but again, I think our people are still going to use masks because they still been very cautious of the infection out there. So I think Guam is somewhat a lot different than the mainland. So I think that even if we say mask is optional, most of us still want to wear masks, including myself.
Doc? What about this FSM vaccination clinic?
We have several clinics beside the UOG that they running every day except on Sunday. Just like tonight, we highly encourage the children come out. I know AMC, GRMC, and the DOE, with the help of the DOE nurse, we're going to run a vaccination clinic for the children from 12 to 17 at Father Doiner's gym.
Right.
To try to reach out as much as possible on the children because I know that there's summer break is coming. And we just need to get them ready for this next school year, which most likely will be face to face. So I encourage the parents to bring the children out tonight at Father Duenas to get them vaccinated. There are a lot of pediatricians going to be out there, just a question concern. So we highly encourage people to do that. And on Saturday, we have FSM outreach in Eagle, which put together by the FSM community, and we was kind of asked the FSM community to come out with their children to get vaccinated at that time. We projected about 500 to 600 people are going to be there. So we are hoping that the FSM community work with their leadership to get out there and get vaccinated. And again, if your children is 12 years old or older, I would encourage them to bring their children along with them to get vaccinated.
What are you hearing about I mean, Doc, remember when we were talking about the path to half, and then you guys had anticipated after we reached the half that it would be slow going to get to that 80% herd immunity mark? Is that still what you guys are seeing? Because it kind of seems like people are still coming out to get vaccinated.
I think all the incentives the people to come out vaccinated, especially with the new quarantine guideline, we saw a kind of slowdown on the vaccination number, and then after the new quarantine guideline, the number started to go up again. So I think that as we make it more readily and put more incentive out there for people to get vaccinated, I think we're going to reach that number is reachable by the end of July. So again, we were talking about, hey, are we going to try to reach out on the high risk population, make sure they at least 75 to 80% vaccinated. When high risk means that anyone that's 50 and over that have comorbidity, so those are the ones that we need to protect, right? Because the bottom line is as long as our hospital admission is low, we are doing very well. And the typical admission to the hospital is really patients that are 50 or older that have comorbidity like high blood pressure, diabetes, and cholesterol. So those are the target that we really need to protect, and we really like to set the goal at least 75% on all those high risk patients. So right now we come pretty close to it, but we still miss quite a bit. So we encourage people that in the 50 and higher come out, because that's where our hospital get bogged down because of the high risk patient. So and if you're young from 18 to 30, and you know who you are, I know you're healthy, and
Yep.
you might not get that.
We know who we
But
are.
again, yeah, and those young, healthy people from 18 to 30 or 40, they really get vaccinated, because remember, if you catch the virus, you're gonna bring it home to your family, and you might have people that high risk in your family. So protect your family by get vaccinated, so that way you don't get sick. So, and there's a lot of literature out there, a lot of data that show that the vaccine now that we are 6 months into the vaccination, and you can see a lot of data out there to support that. So, please, come out and try not to read so much in the internet.
Unless it's the good stuff.
Yeah, it's a lot of good stuff out there.
Doc,
But,
do you know offhand, like, what's the number of people you guys estimate who just can't have the vaccine because of their health and medical reasons?
I would say that on top of my head, Chris, probably less than 2 or 3,000 people on the island that actually cannot have the vaccine for either religious reason or medical reason that they cannot have it. But those are very far and few.
Yeah. Man, I saw something on Facebook, Doc. One of my Facebook friends was complaining about, well, like with the no mask for fully vaccinated individuals, right? Whether it's going to be on the base or out here in the streets. How do you enforce that? And is it a HIPAA concern to go around asking people if they're fully vaccinated? Well, let's say you see someone walking down the road with no mask, and the public health police come out. They're gonna be like, "The papers, let us see the papers." I mean, how do you enforce it? And is it a HIPAA concern to ask people like, "Hey, are you vaccinated?"
It's no, I mean, no one would do that. It's I don't think we have any plan to ask anyone they're vaccinated or not. In public, just because it's an honor system, and that's where have to be accountable for what we do, right? I mean, it's an honor system, so we can't really do that. Now, business-wise, if you walk to the restaurant or you walk to a certain event or something, then yeah, you can ask for those, because you want to keep the people that attend those events or go to a restaurant or a certain part where you want to know that you provide a safe environment for people to go to, right? If you're fully vaccinated, and everyone fully vaccinated in the restaurant or event, then your chance to have passing on the virus to someone is very low. So yeah, in those situations, you have the right to ask, but that's a private entity. But in the public, on outside, you cannot ask people if they're vaccinated or not. That's really an honor system that we have to go through. And again, we just hope that the majority of us are honest enough that we know that if we're vaccinated, you can go without mask, and if you're not vaccinated, then you need to put masks on. It's not a stigma; it's the right that people have.
Well, Doc, I hate to burst your bubble, but we're not really an honor system kind of crowd.
And then nothing perfect, right? But we had to do what the best we can do.
Thank you for your time, Doc.
You're welcome, Chris. Okay, you gotta be safe, okay?
Yep.
Okay.
And remember, Doc said work out with your mask. It's like double the cardio.
And get the children out to be vaccinated. Again, we hope to see you down at Father Duane's gym tonight, okay?
All right, there you go, Dr. Hoa Nguyen, the Physicians Advisory Group Chair.